Thank you for joining me today. In this video, I want to go over with you the personality disorder. Okay. Personality disorder is defined in the DSM-5 diagnosis criteria. That's what I want to go over with the definition of the personality disorder. I want to review the DSM-5 definition of personality disorder with you, understand the cluster A, cluster P, cluster C in depth in a personality disorder, explore risks, genetics, trauma, neurobiological that causes personality disorder, and conduct differential diagnosis, review psychotherapy and pharmacology management, apply concepts to the clinical case analysis. What is personality disorder? It is endorsing a trait of a thinking, feeling, and behavior. Personality is a trait of a thinking, feeling, behavior, and form early and stable over time. So it's stable and it forms over time. It includes thinking, feeling, and behavior. Personality equal to temperament plus environment. Typically is egocentric. Personality disorder is a maladaptive, inflexible pattern linked to distress and functional impairment. Being in adolescent, early adulthood, stable and persistent across the situation. So personality disorder is a continuous and it's persistent across the situation. It begins when the person is getting to adulthood at adolescent age, early adulthood. It leads to distress and malfunction. Diagnostic DSM-5 diagnostic domains is cognitive, self, and others. Cognition effectively arrange intensity and appropriateness. So effectivity is arranged by the intensity and appropriateness. Interpersonal function and impulse control. Those are the symptoms of the personality disorders. Epidemiology: 20 to 15% of adults affected. So 10 to 15 adults are affected. High rates in psychiatric setting. So people who have a psychiatric, they also have some personality disorders, or it is higher in the psychiatric setting. Gender pattern antisocial is more in men. Borderline personality is more women. So women tend to have personality, borderline personality, and men tended to have antisocial personality. Multiple factors cause the personality disorder: genetic, neurobiological, psychology, environment, early trauma, strongly associated with personal disorder, attachment disturbancy attribute more personal disorder, personality disorder. Genetic and neurobiological factors include hereditary, temperament traits. So you get temperament traits from your linear. Serotonin dysfunction increases the impulsiveness. Limbic abnormalities leads to emotional dysregulation. Prefrontal deficit leads to poor impulsive control. That's what the research says. Environmental factors include childhood abuse and neglect. Those leads to personality disorder. Chaos in inconsistent caregivers also leads to personality disorder. Family modeling of maladaptive coping. So if the family has maladaptive coping mechanism, they can model that to their children. Chronic invalidation. Chronic invalidation. So nobody validates you. It can lead to personality disorder. Cluster overview. Cluster A overview. Cluster A personality disorder. Common traits include detachment, art thinking, egocentric behavior, limited affect, social functioning of cluster. Personality cluster A is few close relationship. So that person has a few cluster relationship, interpersonal distrust or discomfort. So they don't trust the others. They have interpersonal mistrust or discomfort. Cognition of cluster A include misinterpretation of events, strange belief, perception of disorders. Wow. Overlapping is related to schizophrenia spectrum, but a mild, not psychosis. So they have similarity with schizophrenia, but there is no psychosis. This is personality behavior, not psychosis. Not psychosis behavior, is personality. Okay. Treatment challenges is a reluctant to change, mistrust, social withdrawal. So the treatment challenge is person is reluctant to engage. They don't want to deal with the treatment or the doctors or no advice or psychs or nothing. And because they mistrust them and they have a social withdrawal. Those symptoms of lack, reluctant engaging or mistrust or social withdrawal, those symptoms can include other diseases of mental illness like depression, schizophrenia, psychosis, manic, bipolar. They have some of these symptoms. Cluster A, predominant distrust and suspicious behavior. Personality disorder cluster A, they have a paranoia. They have distrust and suspicious behavior. Read is behind meaning. So they read the behind. You mean that way, you mean this way, you mean this, that's what it means, this is what is happening. So they read behind the meaning. They are hyper vigilant, hold these grudges. Wow. They hold the grudges. My goodness. Cluster A, they also has a schizophrenia. They have social detachment, restricted emotional expression, prefer solitude activity. So they like to do their own thing because they don't trust the others. They have a detachment from the society. They have restrict emotional expression. Schizophrenia type, egocentric behavior. That's what they have. Our belief is magic thinking, social anxiety with paranoia. That's what they have. That is the description of cluster A. Cluster B, personality disorder, include antisocial, borderline personality, histrionic, narcissistic, narcissistic. That means they think they are the center of the gravity. Okay. Characteristic by emotional instability, impulsiveness, dramatic behavior, chaotic relationships, high rate of self-harm, agitation, attention seeking, grandiose, strong link to drama, mood disorders, substance usage, and they have significant challenge in boundaries. They have a significant challenge in boundaries, treatment engagement, and interpersonal function. Those are the significant that will affect their life. Okay. Cluster B is antisocial. They are antisocial. They avoid rights. They deceit and impulsive, lack of remorse, conduct disorder. So the disorder shows up less than 15. It shows up before you become 15. Before the person become 15 years old, symptoms show up. Cluster B, borderline personality, instability of a relationship and self-image, impulsive, self-harm, fear of abandonment, affective instability. Those are the criteria they have. Histrionic. They cluster B has his part of histrionic, and the attention seekers, dramatic, provocate, shallow emotion, easily influence. Narcissistic is also cluster B personality disorder. They have grandiose, need for admiration. Wow. I'm sorry. Lack of empathy, sense of entitlement. Okay. Cluster C, personality disorder. They have anxiety, fearful, avoidance, dependency, obsessive compulsive disorder. That's the class C. Cluster C, they have avoidance. So they have a social inhibition. They have a social withdrawal, feeling of inadequate, hypersensitivity to criticism. So they are sensitive if somebody told them, oh, something wrong with you, you are not enough. They are very sensitive. They feel inadequate, and they have a social withdrawal. That is cluster A, avoidance. Cluster B, dependency, excessive need to be cared for, submissive, clingy, difficulty making decisions. Cluster C, obsessive compulsive disorder. They have perfectionists. They are perfectionists, preoccupied with control and order, rigid, and inflexible. Assessment is essential. Long-term pattern, not episodal, is long-term pattern. So it needs long-term assessment. Collaborate information essential. Collateral information is essential. Evaluation personal function. You want to evaluate if the person is functioning normally, if they are working, paying their rent, functioning normally, eating, grocery shopping, washing, taking shower, normal ADLs, and functioning like a normal their age and their function. You will rule out if they have medical or substance abuse that causes this behavior. You want to rule that out. Differential diagnosis. Differential diagnosis of borderline personal disorder is similar to borderline or bipolar, OCD, OCBD, schizophrenia, schizotype, avoidance, and social anxiety. Comorbidity. People who have a personal disorders, they also have anxiety, they have a depression, substance abuse, eating disorder. Those are the comorbidity that show up with. Psychotherapy overview. The psychotherapy that personal disorder person will need will be primarily narratively. You wanted the gold standard therapy. Psychotherapy is DBT is the gold standard for borderline personality disorder. CBT is for dystornia tatis. So if the person have disorganized tatis and behavior, they need CBT. And if they have a personality disorder, they will benefit from DBT psychotherapy. Ischemia, psychodynamic therapy, those will be beneficial for personal disorders. Person who have a personality disorders. Pharmacology management. No medication can cure personality disorder. Symptoms you will target the symptoms instead of the person, because there is no cure for personality disorders. There is no cure. But you want to treat the symptoms like the anxiety, depression, personal withdrawal, eating disorders, and the medication that you will use will be SSRIs for depression, mood stabilizer, antipsychotic medication if they have symptoms of psychosis or hallucination or delusion. Avoidance, you want to use benzodiazepine, but there is risky of dependency for benzodiazepine, so it's just a short-term use. Then you will switch the patient to SSRIs for anxiety or depression control. Therapeutic strategy for will be clear boundary. You will teach the patient clear boundary, consistency. You will teach the avoid power struggle. You will teach them manage counter transferency. Those are therapeutic strategies to use and to teach the patient. Case examples. I have a, I love case examples. I have a case examples here. Borderline personality disorder case is unstable fear of abandonment, then plan of treatment for that person. This is 25 years old. They are unstable and they are having a fear of abandonment. You will use DBT psychotherapy plus SSRI for the anxiety that they are fear of abandonment, and you will balance safety and structural follow-up. Key takeaways is personality disorder are chronic maladaptive patterns caused by complex interaction of biological and environment. Therapy cornerstone of the therapy. Therapy is the cornerstone of the treatment. Therapy is the cornerstone of the treatment. The nurse practitioner or the clinician's or provider's role is stabilization, safety, long-term support. So you want to stabilize the patient's mood and behavior. You want to watch for the safety, and then you want to help them for long-term support in the family, in the community, in the providers. You can have a follow-up appointment with them to see if the symptoms come back, if they're taking their medication, if they are functioning normally. Thank you for joining me today. I would love to see you in my next video. Please subscribe and come back. Thank you.